Kayla was born with Holter-Aron syndrome. It's a condition between the hand and the heart. Her spine started curving when she was like 3 months old. Took a very long time to get her diagnosed with scoliosis, and by the time we found out, it was already too late. We lived in Connecticut at the time. Got a letter that said, oh, we have a space available for her to get her into Shriners. We packed up Connecticut and left. Came for Florida and been working with Dr. Cronen since we got here.
We're doing a child who had infantile idiopathic scoliosis and had growing rods placed in another institution that failed, and she moved down here to have them revised, and then we've been every 6 to 12 months or so taking her back to the operating room and extending her growing rods to keep her growing and control her curve until she's old enough to have a definitive fusion. These rods, when she first had them put in, were touching each other, so you couldn't see anything inside of that cassette, and each time we go in, we stick a little distractor device in there and click, 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 distract it, stretch out her curve a little bit, make her a little taller.
When she was born, they had originally told me she was never gonna walk. She wouldn't live past 5 years old. She's 9. So at that point, you know, you start thinking, oh, okay, well, this kid's gonna beat all the odds that they're telling you.
When am I gonna be able to ride a bike?
I don't know, can you already ride a bike? Okay. She's a bit of a fire plug. She has kind of boundless energy despite her limitations. You know, as you all saw, the first question that she asked when I went in there this morning was, when can I ride my bike? So she's a cool little kid.
We've never allowed her to think that she was handicapped or disabled or anything like that. For anything, she learned how to tie her shoes. She only has 7 fingers, you know, and it was the whole, I'm not wearing Velcro shoes to school. Well, then you gotta learn how to tie your shoes. And so she learned how to tie her shoes.
She's tough. She doesn't let anything hold her back, and that's what's really good.
She's exceeded most expectations. Every time anybody tells her that she's got a limitation, she defies it. So I would say she can do whatever the heck she wants to.
When we come to Shriners, we come to see Dr. Cronen. You know, he has a lot of patience, but that really doesn't matter. You know, the minute he comes in through our room, nobody else exists.
With him, it was an instant trust.
He's a good doctor and he works really well on me.
As her parents, we know her better than anybody else. But right after we know her, he knows her.
The kid's been dealt every possible bad card you could, and despite that, she just goes, and that obviously is going to have the greatest impact on what she's ultimately able to do and accomplish. It's just she just has that never give up attitude. You know, there's nothing, you can't implant that in anyone.
Honestly, he's been a blessing. Shriners, they've been a blessing because we couldn't have done it without them. There's no way.
Her quality of life improved because of him so much.
It's kind of like an organ, you know, perfect match.
Yeah.
They really are.
Shriners is important to Kayla and her family because it's a place where she can go and get exceptional care for all of her exceptional needs, which she has a lot of. I get to do what I love to do, and you know, the kids here benefit from that. So
They treat me well because I have back problems and they do back surgery to make me taller.
Shriners, it's the hospital you see on commercials all the time. It's like, wow, I really want my kid to be part of that hospital. And for us to get an opportunity to come, it was an easy decision to say, okay, we're uprooting the whole family from our home state and leaving. Because we knew she'd get the best care here. It's like a family, you know. All the nurses know her, the doctors know her. They've seen her grow up. It just leads us all back to Dr. Cronen. You know, he has her. Will I let another doctor operate on my daughter? Never. No, I won't move back to Connecticut. We won't leave Florida until her last surgery where he says, that's it. This is where we'll stay.
What color you want your bike to be?
Purple.